So now we're going to go just like we did, and we're going to talk first about the gram-positive cocci. And just like we said earlier, we're talking here about staph and strep. Now, before we get into talking about each one specifically, what I'm going to do is kind of compare and contrast them in an overview on some tables, and then we'll go specifically to some of the species and causative agents. All right? So, first, with staph and strep, okay, the first thing I want you to know is that blood agar for all of these is going to be an important culture medium. All right? So remember blood agar. Now, staph is beta hemolytic on blood agar. It's not something you think about all the time. If you read, I know when you read beta hemolytic gram-positive cocci, I know you're going group A strep. I know you. But you got to remember that Staph aureus is also described as a beta hemolytic gram-positive cocci. So, in the case of impetigo, what if I said it's a beta hemolytic gram-positive cocci? And you write group A strep, but they were going for staph. So you really have to be cautious of that as you're reading the vignette. All right? And I'll go into further detail on hemolysis when we get to the specific species. All right? Now, the genus Staph, as you know, we're talking about Staph aureus for the most part, which is the major clinical pathogen. Staph epi, which we mentioned earlier as part of your normal flora, and then Staph saprophyticus. Okay? Now, how do you differentiate Staph aureus from the other species of staph? And there are a couple of different ways we can do that. Number one, Staph aureus is the only one of those three that I mentioned that is coagulase positive. All right? So Staph aureus will actually, when it gets into plasma, it will cause that plasma to clump or clot. All right? That is a byproduct of the coagulase. Also, Staph aureus will ferment mannitol. So sometimes it's cultured on mannitol salt agar. It will ferment the mannitol and you'll see those colonies become yellow. And it's also a little bit halophilic, meaning that it also doesn't mind a little bit of salt. Okay? So that's how we're going to differentiate it from the other species in that genera. We'll talk specifically about these disease presentations when we talk about the organisms specifically, okay? Now, the next thing I'm going to say is I can't stress enough. You have to know that the easiest way to differentiate between staph and strep is by the catalase reaction, all right? And here's why. Just like the example I gave you before with impetigo, impetigo used to be predominantly caused by group A strep, but now it's almost equivalent. You have just about as many cases where Staph aureus can cause impetigo as group A strep. What's the easiest way to tell what the causative agent is? You put a little hydrogen peroxide on it. If it bubbles, or if it's catalase positive, it's Staph aureus. If it's strep, it's catalase negative, and you won't get any bubbles when you add the hydrogen peroxide. That is the simplest way to differentiate between staph and strep, all right? And they love that question, all right? They'll give you a case of impetigo. If you've got a kid that comes in, what's the buzzword, with honey-crusted lesions on the face, they take a little sample from that material, and they put a little hydrogen peroxide on it, and you had a reaction. You had bubbles. What's the most likely agent? Staph aureus, okay? So that's really important. Now, as you look down at epi and saprophyticus, you'll notice that those are also catalase positive. But as I mentioned before, they do not have a coagulase, so they won't clump that rabbit serum. And unlike Staph aureus, that's beta hemolytic, Staph epi and Staph saprophyticus are what we call gamma hemolytic. Now, gamma is a little bit of a misnomer because gamma means that there's actually no hemolysis at all. So instead of saying non-hemolytic, they just call it gamma. Now, because epi and saprophyticus are both gamma hemolytic, one of the ways that the USMLE might ask you to differentiate between them is going to be based on antibiotic sensitivity, where Epidermidis is sensitive to the antibiotic novabicin, and saprophyticus is resistant to novabicin. Okay? Now, the only way I think they could make that clinically relevant would probably be in the case of maybe a UTI. But even such, typically, Staph saprophyticus causes uncomplicated UTIs, usually in younger women who have just recently become sexually active. Whereas epi, you're not going to see just randomly causing a UTI, but it's usually, remember, it's part of the normal flora, so it's usually more of an opportunistic infection and causes UTIs when there is associated use of a catheter. So by the vignette, you should be able to tell the difference, but if they want to know for sure, you go down to novabicin sensitivity or resistance. One of the things they might ask you, they might give you the case of, let's say you had an 18-year-old female that presents with frequency and urgency and hematuria, let's say, and they might say, what's the test that you would do to differentiate it, from other members in this species? And that would be novabicin. Or what's the quality that goes along with the organism in this case? It's novabicin resistant. Okay, so definitely want to keep that in mind. Also, along the lines of UTIs, when we talk UTIs, typically we're referring to a whole slew of gram-negative rods. Okay, so if they're telling you somebody has a UTI and they find gram-positive cocci and there's no catheter associated, it's more than likely Staph saprophyticus. All right, so that's where that's really clinically relevant for you. All right, so let's leave staph for a moment and start to look at the genus strep. Okay, the streptococci are all catalase negative. So you're going to hit them with hydrogen peroxide, they're not going to do anything. Okay, so that's the first thing you got to know. Additionally, they're all coagulase negative. Okay, like we talked about for Staph epi and Staph saprophyticus. Now, one of the ways that the streptococci are differentiated are based on their hemolytic pattern on blood agar. And what did we already talk about? We said that Staph aureus and Strep pyogenes were both beta hemolytic. Okay? In addition, group B strep, or Strep A galactiae, is also beta hemolytic. What does that mean? That means when those organisms are growing on blood agar, they completely lyse the blood around the colony, and you have this complete clear zone surrounding the colony. All right? You can see through that blood agar plate if it's beta hemolytic. All right? So, Staph aureus, Strep pyogenes, Strep A galactiae, beta hemolytic. Okay. Now, differentiating group A from group B strep, just like we did with saprophyticus and epidermidis, is by antibiotic sensitivity. So, group A strep is sensitive to bacitracin, whereas group B strep is resistant to bacitracin. All right? Some of the other features, again, we'll highlight in a little bit more detail when we talk about them a little bit more specifically. All right, next on the list is strep pneumo. Strep pneumo is extremely high yield, all right? So that when you start reading alpha hemolytic gram-positive cocci, it really should be the first thing that pops into your mind. Are you just going to go answer strep pneumo or capsule? No. You're going to read the whole question, okay? Because the viridan strep that we talked about that were common flora of the oropharynx are also alpha hemolytic. Can the viridan strep cause pneumonia? Absolutely they can, okay? You think of somebody that may aspirate some of that contents, it gets into the lungs, it can certainly cause pneumonia. How are you going to differentiate strep pneumo from the viridans pneumonia, antibiotic sensitivity and resistance? Okay? So, strep pneumo being sensitive to the antibiotic Optichin, and the viridans strep being resistant. Okay? And then, kind of trailing here, leading up the pack, is Enterococcus. Whenever I read Enterococcus, I can almost get tricked into thinking, oh, Enterobacteria gram-negative. You can't do that. So you got to remember Enterococcus is part of that gram-positive cocci group. All right? Now, for hemolysis, it's really not going to be of value to you to know the hemolysis because it's all over the place. It could be any of the different hemolytic patterns depending on the species. That doesn't mean they won't put it in there to throw you off, but it's just not going to give you any information as far as Enterococcus. A couple of things that are going to help you in the diagnosis of an enterococcal infection are going to be, one, the PYR enzyme. Group A strep and Enterococcus are both PYR positive. All right? And that's an enzyme we're not used to talking about much, but as far as diagnosis is really kind of becoming one of the more relevant tests to do for the strep, so it's going to be an important test. Also, the enterococci can hydrolyze esculin, and they will turn black on what's called bile esculin agar. So that's another way you can differentiate the group D strep or Enterococcus from some of the other groups.